I am Dr. Sachin Kuber and I am the surgeon at www.circumcision-clinic.in, and our clinic is in Pune city, Maharashtra. Today I am going to talk about the best method of circumcision. See, as a circumcision center, we are offering 5 types of circumcision, and these circumcisions are designed according to the need of the today's world. So the main concern of the patient is pain. Second concern is taking rest at home. Third concern is recovery time. Fourth concern is returning to the job or returning to the normal exercise routine. And number 5, most important, return into sexual life. So one by one today I will tell you about the best method of circumcision. Now in this today's world, that is 2017, people are very busy, they don't have time, and they want a quick circumcision, they want painless circumcision, and we have the answer. We are offering the best circumcision methods. There are 2 types of circumcision methods. Number 1 is circumcision by surgical methods, that is old methods of surgery. That is, there are 3 types which we offer. Number 1 is basic circumcision, number 2 is advanced circumcision, number 3 is cosmetic circumcision. In all these 3 types, the skin of the penis is cut by a scissor, and after cutting the scissor, the stitches are put around the glans penis head. So according to the requirement, the skin is cut loose or tight or ultra tight. So this depends on person to person. Suppose for example I tell you that for basic circumcision what we do is we cut the loose skin so that it can cover some part of the glans penis after the surgery. This is usually recommended for old people who want to avoid the urinary obstruction, who may not be very much sexually active. Then comes the advanced circumcision, that is the sharp cut at the glans penis and somewhat loose skin. This is for middle-aged people. And the best one is the cosmetic circumcision, that is a sharp and tight, ultra tight cut over here, and the upper part is the skin, which is very tight. So the glans penis always remains exposed to the air and water. This is the cosmetic circumcision. All of them involve cutting by scissors, ultra sharp scissors, and putting the stitches. And entirely number 2 category is the stitchless circumcision. This circumcision is a very new idea of doing circumcision. This is a very quickest way to do circumcision. Just now I told you that the basic, advanced, cosmetic circumcision surgery is done by scissors and putting stitches, and it takes around 45 minutes to complete the surgery. But now with the help of the new methods, that is a stitchless circumcision, we can do this surgery in less than 10 seconds. Yes, you are listening correct. It is done in less than 10 seconds. So I will explain. The first device that we use is called as Alice clamp circumcision. This is a special kind of device which is put on the penis in around 5 minutes, and you are free to go home. Let me show you. See, this is the device, and see, it has a tube over here, and this is the part which is near to your penis. So ideally we put the penis head inside and the skin around this part. So there is a clamp mechanism. In 7 days automatically the skin gets dead and it is cut off on the day 4, and after 7 days this clamp is removed and you are through. Circumcision is done. This is painless. You don't understand anything, you don't feel anything, and really you can work in those 7 days. There is a small black ring that falls down in 7 days after removal, and you are free to go. So there are no involvement of stitches, and this means that there is no pain, because of stitches there are chances of pain, infection. This is a very sophisticated device, and because of this, one very important thing that can happen is, due to the older methods of surgery, the stitches which are there can produce ugly scar, and that scar involves some of the important nerves, and those nerves can become painful after traditional surgical circumcision. So I see regularly many patients who have problem of having pain, say after 3 months or 6 months after the traditional circumcision. So the patients who have traditional circumcision may face, I'm not telling every patient can have that problem, but after say 3 months, 6 months or 1 year, that nerves which are there at the line of the stitches forms a scar, and that becomes painful. So it might give you pain at the time of intercourse. So these all problems are completely removed with the help of this Alice clamp circumcision. Or the next big thing which is coming, or already in India, we as a circumcision center have started last 4 months or 5 months. We are doing the best circumcision. Let me show you that this is the ZSR circumcision. This is the ZSR machine. This is a specialized machine which involves 2 parts, and with the help of this part, what we can do is this protective cap goes over the glans penis. I'll show you. This protective cap goes over the glans penis, and this part is fitted into this, and it is tightened, and the skin which is stretched over that, and a very fine steel titanium closed blade comes out through it, and once you fire it like this, once you fire it in 1 second, it cuts the foreskin exactly in the proper manner on all sides equal, not uneven, because in traditional circumcision, because of the surgeon's hand is cutting, there is a chance that the skin can be cut uneven. Say many of you agree with me that on right side or left side there is unequal cutting. So because of this device, exact round cutting is done, and this cuts in 1 second, and at the same time that cut is sealed in 1 second. So there is no chance of bleeding. The healing occurs in 7 days. There is a silicone ring which is deployed on the penis, and this ring will fall down in 7 days. So these are the best methods of circumcision which can be done at our clinic. You are welcome to do it, because our center is the only center in India which offers so many choices of circumcision with us. So for the latest and best methods of circumcision, my number 1 choice for circumcision is this ZSR circumcision that I recommend, because it is painless, bloodless and stitchless. It is done in only 10 seconds, and the healing and the scar which is formed is uniform. There is no pain after 3 months or 6 months or 1 year after the circumcision. Skin remains as it is, and the inner sensitive mucosa or sensitive foreskin is not cut. That's why this circumcision does not lose the sensitivity after the circumcision. Many people are complaining about the losing of sensitivity after the circumcision, but with the help of this ZSR, there is no loss of sensitivity whatsoever. So my number 1 is circumcision is this one. My number 2 is this one, that is the Alice clamp. So both these stitchless circumcisions are best in today's world. I hope this video was helpful. Do subscribe to us and for these new videos, and let us know, or you can call us, you can WhatsApp us on 98238 63926. Thank you.